Hi, my name is Sarah. I'm a student physical therapy assistant, and today we're going to discuss a case study regarding for shoulder pain, and they're using a physical therapy. Shoulder pain is a muscle spasm. There's a numbness or tingling sensation. Pain is dull or achy. Sometimes it's sharp pain or is severe by trigger or worsened by overuse or everyday activities like example overhead lifting, using your shoulder repetitive, and inability to move your shoulder. You kind of like feel your shoulder it's weak and kind of like more tiredness or fatigue, and sometimes it's stiff and swelling. This case study is focusing on 41 years old female is a worker's comp injury, work as a packer, assembler, decreased shoulder mobility and strength, inability to perform activity daily living such washing her back, and she's seeking a physical therapy to decrease pain, right shoulder pain, and she wants to return to work without restriction or without discomfort. On initial evaluation, the examination finding, which is reduced range of motion. Her range of motion on shoulder flexion, it's hypomobile and it's 115 degrees, which is hypomobile, and the shoulder abduction also hypomobile. It's about 120 degrees. The normal range for each range of motion it's 150 degrees. That's the normal range, and for the physical therapies, assess the manual muscle testing too, and the result comes out with shoulder flexion. It's four minus. Um, it's a little bit weak, and for the abduction, it's 3 plus, which is weaker. So her pain in worse it's 8 out of 10, and she feel like a tight on the anterior deltoid, and her pain in best it's 4 out of 10, which is when she relax her shoulder she doesn't do anything overhead activities, and her upper extremity quick dash it's 25 out of 100 to measure it if there's any disability, and shoulder pain disability index total is 44.6%. So now we're talking about intervention. Intervention is some exercises or intervention or theories that will help the patient to increase the shoulder mobility and strength. Patient perform a upper trap stretching, which is you move your head to the side, and you feel the stretch right here on your upper shoulder. Usually the frequency of this it's hold it for 30 seconds and do it 2 to 3 sets, which is the patient feel the stretch right here to improve the performance in physical activities. Patient perform here's some intervention for shoulder pain. So one it's assisted active range of motion shoulder flexion, which is you can use it with cane or a hard stick and do the plane of flexion. Do it like this. Patient this exercises it's help to increase their mobility and strengthening the muscle as well. And we have some. Prone tees and prone wise exercises is another intervention to help you strengthen your rotator cuff muscle for more shoulder stability, which is this exercises is targeting the supraspinatus, upper and lower back trapezius. And it's also help to this exercises if you have a poor posture, which is emphasizes to have a good posture. Shoulder extension with Durban, resisted Durban. This and other exercises will help to improving your shoulder stability, scapular control, and upper back strength. Overhead press up intervention. This intervention is to strengthen your shoulder, trap, and tricep muscle, which is improve your also your core strength, balance, and stability of your shoulder. It also carries over to push activities and exercises. Also, palmar carry. This is another exercises that with kind of like more of functional activities that will help the patient to achieve the goals, which is in order to return to work without restriction. Example: patient wants to achieve lifting more than 20 pounds. This is an example of intervention. It's improve your grip strength and your shoulder stability too. Another intervention is shoulder internal and external rotation with resisted bands. This exercise it help to balance the rotator cuff muscle for shoulder stability, and it also help to increase your posture. This exercise is targeting your infraspinatus muscle, which is we need to strengthen that muscle in order to improve the overhead lifting and reaching. Scapular retraction with resisted band, another intervention, which is improving the integrity of strengthening of the muscle around the shoulder blades, as well as help to increase or maintain the comfortable posture.
Outcomes for this patient is notable progress in her physical therapy treatment with a significant reduction in her pain reduction from 8 out of 10 to 2 out of 10, which is a good start for her, have a patient confidently move her right shoulder. Her range of motion in the right shoulder has been improved also, allowing her to achieve approximately 150-degree flexion and abduction motion, which is essential for performing overhead activity, such example washing her back independently without discomfort or pain free. And this improvement reflects the effectiveness of therapeutic exercises and manual therapy techniques used in her treatment plan. In addition, patients showed enhanced strength also functionally in the right upper extremity and ability to lift existing 20 pounds as her goal to be restored and meeting her long-term goal to returning to work without restriction. Discussion. Working with the patient provide a valuable insight into complexities of managing shoulder injury and effectiveness of targeted physical therapy intervention. Her progress emphasized the need of tailor of intervention to address specific deficits such as pain management, range of motion limitation, and muscle imbalances. One notable with the patient treatment was challenging managing her upper trap overactivity while performing functional strength in the right shoulder. And one notable aspect for patient treatment was challenging for her upper trap overactivity while performing functional strength in the right shoulder. And it becomes evident that balancing the strengthening of the rotator cuff periscapula muscle with postural correction required careful consideration and frequent adjustment. Reflection in this case study is patient case demonstrate of significant personalized therapy plans and dynamic nature of physical rehabilitation. The success of her treatment journey, efficiency, targeting exercises, and manual therapy facilitating the recovery, the right shoulder strain. This experience is made the understanding of how to adapt a physical therapy strategy to meet individual patient needs and will guide approach in the future with similar cases. All right, thank you for listening to my presentation. Hopefully, this case study will help you in the future if you haven't treated patient right shoulder pain and with strength deficiency. Hopefully, this case study helped, and thank you. All right, thank you for listening to my presentation. Hopefully, this case study will help you in the future if you haven't treated patient right shoulder pain and